there could not be a bigger champion of a change in our legislative framework to fight infectious diseases than myself. In my position as the Director General of the newly established Nigeria Center for Disease Control, we are the most affected by the deficiencies of the laws as they stand at the moment in our fight against infectious diseases. Mr. Speaker, in answer to your two specific questions, these questions were thrown to me in the context of a television interview on the same morning that I had seen the bill for the first time. You're absolutely right in saying that the point for consultation had not reached. But I was answering to a specific question by the journalist at the time. Had I been consulted? The only honest answer to give at the time was that I hadn't been, because I hadn't been. So I really look forward to having the opportunity to working with your House in refining this bill. The responsibilities of the Nigeria Center for Disease Control are actually very specific. There are many other stakeholders that have wide-reaching responsibilities at the federal, at the state level, at the local government level, in protecting us from the threat of infectious diseases. So, Mr. Speaker, without going into the details of what was said or not in the public space, I'd like to assure yourself and all the members, and I think I speak for the Presidential Task Force, my Honorable Minister, and every member of our team, that we look forward to a new infectious disease bill, in fact, a new public health bill that brings together the functions of all the agencies, defines responsibility, and leads us to a position where we can really be in a stronger position to protect the health of Nigerians in our Federal Republic. Mr. Speaker, I am sorry if these comments caused any offense, but you could not have a stronger ally. You could not have a stronger ally in the review of our legislative framework to the fight against infectious disease in our country. This really is a war, and the context is that we're fighting a war really on 37 fronts at the same time. Each of those fronts is one state in Nigeria. There were a series of questions around testing, and I'll just try and answer them together. We have three goals in testing that we're trying to solve. We're trying to solve for proximity, to bring the test closer to people. We're trying to solve for scale, to scale up the number of tests we're doing, and we're trying to solve for the future, so that whatever we build will be here to last. Sometimes the solutions are not the same, because there might be just one case or two cases in Imo State, but they need a testing center in the state. While in Lagos, we have half of all the cases, and we need to solve for numbers. So we're working on all those together. Right now, as we speak, I have two teams. Innocent and Emeka Ndodo are in Port Harcourt. From Port Harcourt, they'll go to Owerri and then Oka to set up these three centers. Abdul Majid and Sarah are on their way to Gombe, and from there they'll go to Yola. So far, since I met you the last time, we've moved our testing centers from 5 to 21. And we're pushing every single day to bring a test center to every state in Nigeria. That is solving for proximity. For scale, we have set ourselves a target to test 2 million Nigerians in the next 3 months. And we have developed a specific strategy around this with a procurement plan with our UN family brothers, partners, working with us together to achieve these targets. These are the targets that we have set for ourselves. Today, we have tested just 20,000, but even at that 20,000, we are not fulfilling the capacity that we have at the moment. Because testing doesn't only depend on the lab. It depends on the logistics of collecting the sample and transporting it safely and everything around that. So we'll continue working hard to make this better. We have a challenge in a few states that we are simply not collecting enough samples from. We haven't had a confirmed case in Kogi State. We haven't had a confirmed case in Cross River State. There are other states with very low numbers of cases. We have been encouraging all the states in Nigeria to continue trying to collect samples. The only way we can know whether we have this disease or not is if we test for it. If we don't test, we will not know. So we continue to work collaboratively, supporting states with the infrastructure, with the human resources, with the virus transport media, with the nasopharyngeal swabs, everything they need to collect samples so that we can test. Our role at Ncdc is to support the states. The states are our primary clients in all the work that we do. Then I move on to Honorable Walba's question, and I think he asked if Ncdc was sleepy. Honorable brother, to be honest, we haven't slept in 3 months. So the answer is actually to the contrary. We have a small team when we started of just 200 technical staff in Ncdc that have been asked to carry on this challenge for the country. We do it in collaboration with many other public health workers across the country, trying to work very hard to support the states, our tertiary hospitals, and everyone involved in this response. We have only been able to do it because of the collaboration of many other parastatals in the health sector, the National Primary Healthcare Development Agency, National Agency for the Control of AIDS, and really all the other parastatals that have supported us with human resources, logistics, and infrastructure just to manage this outbreak. Around the treatment centers, there have been a lot of complaints about why Ncdc is not picking up people to come into treatment centers. The responsibility for treatment centers is actually one of the states. Our role is to support them with guidelines, with knowledge, with infrastructure, sometimes with support in order to do this. And I can tell you for sure that every state has been working very hard to increase the treatment capacity they have. No country can increase the number of bed spaces available by 300, 400% in 2 weeks. But this is the challenge that we are faced. And you would have seen that the state governments have been proactive on this. Lagos just opened the 5th large treatment center in Bagada. In Abuja, the federal Ministry of the Federal Capital Territory is working very hard with a lot of partners to open the dome up to take in more patients. As I traveled around the country last week, every single state is working hard to increase the treatment capacity in their state. So we have to support them in this regard, and that's exactly what we're doing. In terms of our burial guidelines, we have burial guidelines. We call it actually the guidelines for safe and dignified burial. Safe is important, but dignified is also important. We try to ensure that when the burial happens, it happens safely, but we also respect the norms, tradition, and religion of whatever group is burying their dead. We never take the corpses away. It is the state government that works with the families to find a way of organizing the funeral, but never is any corpse taken away from the family. So those guidelines are available on our website, and they're very easy to read and to understand and to use. There was a question on how prepared we are for the second wave. We are working very hard. No time have I worked with a set of leaders in the Presidential Task Force that are so committed to improving our level of preparedness over the past few weeks. And we know that this is a marathon, that our work is cut out for us, and we'll have to continue doing this for the months ahead. So every day we meet for a number of hours to re-strategize, to find new approaches, to bring in the private sector, work with the states, and really leverage on all the resources available to our country to make sure that we improve on our response. There was a question about the difference in the epidemic in the UK and Nigeria. The challenge is every country's epidemic is different. We have this virus now in close to 200 countries around the world. Some have experienced an explosion, others have not. And so why an outbreak happens in any country depends on an interface between humans, the virus, and the environment. And the circumstances are different in every context. Our role is to make sure Nigeria tries and uses all the resources available at our disposal to make sure that we're better prepared to respond. There was a question that said Ncdc has failed Nigeria. I think history will judge us. And let's work together in the short term to get to the end of this. Now is not really the time to decide on whether one group has failed or not. Now is the time to come together as a country. Executive, legislators, state, local, federal, everybody, we need the support of everyone. This outbreak is not going to end next week. I will be criticized for saying this again. But that is the honest truth. We will not get to the end of this next week or the week after. It's a marathon. We need everyone playing along as we move forward. Finally, Right Honorable Speaker, I want to end with an appeal. Appeal to all the honorable members in this House to please use your voices. We need your voices as part of this response. Neither testing nor treatment is going to get us out of this situation. We can only get out of this if Nigerians come along with us. We need to adopt a new way of life, a way of life that is alien to us. And it is very difficult. So we need your voices to help Nigerians come to terms with physical distancing, come to terms with what we're doing in this room at the moment. All of us sitting more than 2 meters apart, wearing masks. It is very difficult for a majority of Nigerians to do. So we need your voices. We need it desperately. We need Nigerians to come to terms with washing their hands and using sanitizers all the time. And not just Nigerians that can afford it, but all Nigerians. This is a Herculean task, but this is the task that history has given you and given us. Let us work together as we drive all our energies together into the future that we'll now seek. And on my part, I'll end by saying, I look forward to working very closely with you, Right Honorable Speaker. I look forward to working very closely with you, Right Honorable Speaker, to craft a new set of laws to define the work that we do on infectious diseases so that we're never in this type of situation again. Thank you.